Hey there. So today we're doing a deep dive into something I know you've been curious about, and that's knee osteoarthritis. I've got this super interesting research paper here written by a physical therapist, and I'm ready to break it all down.
Yeah, it's a great paper. Definitely goes beyond just the basics, that's for sure. We'll really get into what knee osteoarthritis actually is and, what causes it beyond just like getting older. Yeah.
Because it's not that simple, is it? It's like our knees don't just wear out.
Right.
I thought it was interesting how the paper starts off by literally breaking down the word osteoarthritis.
Yeah, it's a good way to think about it, Arthro for joint and then osis, degeneration or aging. So it literally means like the joint is degenerating.
Okay, that makes sense. But it's the cartilage in the joint that actually wears down, right?
Yeah, exactly. Cartilage, that's the slick, smooth tissue that helps our bones glide over each other. The paper uses this analogy of like the tread on your tires.
Okay.
Which I always thought was a really good analogy.
It is. So over time, that tread wears down, or that cartilage wears down.
Right.
And it's like things start getting a little bumpy in there.
Yeah.
And then they even had those anatomical models, which I thought was cool because you can really visualize the cartilage, the meniscus, that whole structure of the knee joint.
Yeah, those visuals are really helpful. They really help you understand what's going on in there, how it's supposed to work.
Right. So age is a factor, but the paper really emphasizes it's not the only thing. What else is contributing to, all this cartilage breaking down?
Well, remember that tire analogy?
Okay, yeah.
Say your car has a wheel that's out of alignment. Even if you're driving normally, that tire is going to wear down a lot faster.
Oh, because it's not making even contact with the road.
Exactly. So in the same way, mechanical imbalances in our body, even subtle ones, can put uneven stress on our joints.
Okay.
Which, that leads to more wear and tear on the cartilage. And that the paper actually calls these alterations within the knee joint.
Alterations.
So anything that kind of throws off the joint's normal mechanics, right?
So what causes these alterations? Is it old injuries, or is it just how?
Yeah, old injuries are a big one, right? Because they can really disrupt the way the joint moves. It can put stress on different areas that weren't meant to be stressed, but it's not always that obvious. Even everyday movements, like how we walk, stand, sit, all of that can contribute to these imbalances if we're not careful about it.
So our habits really do catch up to us.
They really do. And then there's the whole issue of muscle imbalances, which, we'll get into a little bit more later on. The paper really delves into that. But one thing that I thought was interesting that the paper mentioned were these visceral and vertebral influences.
Oh, wait, are you saying that our organs and our spine can impact our knees?
It sounds crazy, but
wild.
Our bodies are really interconnected more than we think.
Yeah.
So think about this, right? Your digestive system sits right below your diaphragm. If you have digestive issues or if your diaphragm's constantly tense, that can impact the alignment of your pelvis.
Okay. I'm starting to see where this is going.
Exactly. And then if your pelvis is out of alignment, well, guess what? That throws off the alignment of your entire leg from your hip to your foot. And what's at the bottom of that chain?
The knee.
Your knee.
Okay.
So it can put all this uneven stress on the knee joint. It's this chain reaction,
Wow.
And same thing with the spine, right? If your back is out of whack, that can trickle all the way down and affect your knees too.
It really is all connected. Okay, so we've got age, old injuries, everyday movements, how we're moving, muscle imbalances, even our organs, our spine, potentially messing with our knees. Anything else I'm missing?
Well, there's one more major culprit that the paper talks about, and that's constant tension.
See, this is where I was this is where it gets really interesting for me.
Yeah.
Because they use that example of squeezing your arm, to illustrate this.
Oh, yeah, it's a great example, right?
Mm-hmm.
If you think about it, your arm, it can handle being squeezed for a short period of time, right? You squeeze it, you release, you squeeze it, you release, no problem.
Right.
But what if you just apply this constant pressure, you never give it a break? That's when the damage happens.
So it's not just how much stress those joints are under, but it's for how long.
Exactly. And so if your muscles are, chronically tight, or if you're putting constant strain on your joints, it's kind of like that constant squeezing, it's not good news. It can lead to problems. And the paper actually calls this out as a really, really crucial factor. And it's often overlooked, I think.
So it's like taking breaks from sitting, stretching regularly, all that kind of stuff.
Yeah, exactly. It's all about giving those joints a chance to, decompress, let that cartilage really, get some breathing room.
This is making me want to get up and stretch right now, honestly.
Yeah.
But okay, so it seems like we actually have a lot more control over our joint health than maybe we realize. Like, we can't control getting older,
Right.
but we can control how we move, how we manage our stress.
Yeah, absolutely. And even things like, genetics, or if you have a job or you play sports that puts a lot of repetitive strain on your body, which the paper does mention.
Yeah, it acknowledges that.
Even then, like, addressing these things that we've been talking about that you do have control over, it can make a huge difference.
Mm-hmm.
It's like stacking the deck in your favor.
I love that. Okay, so we've talked a lot about the why behind osteoarthritis,
Mm-hmm.
but what about the, like, what now? This paper was written by a physical therapist, so I'm assuming it gets into, like, treatment.
It does, yeah. And it takes a really, like, holistic, body-centered approach.
Okay, so what does that look like in practice? Like, if someone's dealing with knee osteoarthritis, where do you even begin?
Well, going back to our car analogy, right?
Okay.
If your wheel's out of alignment, you wouldn't just, like, slap a new tire on there and call it a day.
Right, you got to fix the alignment.
You got to fix the underlying issue first.
Right.
And so with knee osteoarthritis, that often means addressing these mechanical imbalances that we were talking about. That's often where physical therapy comes in.
Okay, so walk me through that. What did that actually look like? Like, how does PT help with those mechanical issues?
Well, it's always going to be individualized, but it often starts with a really thorough assessment. It's like detective work almost. The physical therapist is really trying to pinpoint, like, where are the movement limitations? What muscle imbalances are present?
Mm-hmm.
How's your posture?
So it's really getting to, like, the root cause, not just treating the symptoms.
Exactly. And then once they have a really clear picture of what's going on, they can put together like a really tailored exercise program to target those specific issues.
So what kind of exercises are we talking about here?
Well, a lot of times the focus is on strengthening the muscles around the knee, especially your quadriceps, those muscles on the front of your thigh.
Okay.
Those are super important for shock absorption and just supporting the knee joint in general.
So stronger quads, more support for your knees. That makes sense.
Exactly. And then improving flexibility and range of motion is also super important.
Okay.
Because if that knee joint is really stiff and it can't move through its full range, that's putting more stress on the cartilage.
So it's not just about strength.
Mhm.
It's about making sure everything can move the way it's supposed to.
Exactly. Exactly. And then we can't forget about low impact exercises, things like walking, swimming, cycling.
Because those help keep the joints moving without putting too much, like, pounding on them.
Exactly. Exactly. It's about finding that sweet spot where you're challenging yourself, but not overdoing it.
Yeah.
And that sweet spot is going to look different for everybody.
Right. And I know you're big on this whole, like, whole body approach.
Yeah.
So even if someone is coming in specifically with, like, knee pain, you're looking at the bigger picture.
Oh, absolutely. Yeah.
So we talked about how the pelvis and the spine can impact knee alignment.
Right.
Are you incorporating exercises for, like, hip stability, core strength, that kind of thing?
For sure.
Even addressing those, like, visceral influences that we were talking about.
Yeah.
Like, if someone's having digestive issues, maybe that's contributing to pelvic floor tension.
You got it. It's all connected.
It is all connected. This
Yeah.
is all making so much sense now. So physical therapy is a big part of this holistic puzzle.
Mm-hmm.
But what about the things that people can do, like outside of their PT appointments, to support their knee health?
Yeah, well, that's where those lifestyle factors come in, right?
Yeah.
And this paper does a really good job of addressing those.
Perfect.
Yeah,
Because those are the things that we actually have some control over,
exactly.
which can be really empowering, I think.
It is.
Let's start with diet. What's the connection between what we eat and the health of our knees?
Well, there's no one-size-fits-all osteoarthritis diet.
Right.
But research is showing more and more that inflammation plays a really big role in osteoarthritis.
So inflammation, that's our body's natural response to injury, irritation.
Yeah, but that chronic, low-grade inflammation, that's not a good thing.
Okay.
And what we eat can either fuel that fire or it can calm it down.
Okay. I see where you're going with this.
Yeah.
So what are the foods that are kind of like fueling the fire?
It's usually the usual suspects, right? Highly processed foods, sugary drinks, unhealthy fats in excess. Those can all trigger inflammatory pathways in the body.
So those are the things to kind of be mindful of.
Yeah.
What about the fire quenchers? What should we be loading up on?
This is where it's really helpful to have a nice, colorful plate.
Okay.
So think fruits, vegetables, especially ones that are packed with antioxidants.
Berries, leafy greens, all the good stuff.
Exactly. And omega-3 fatty acids, Those are fantastic for fighting inflammation.
Okay.
You find those in fatty fish, walnuts, flax seeds.
Okay.
And then don't forget about spices like turmeric, ginger. Those have some really potent anti-inflammatory properties.
I'm getting hungry. You're making me hungry. I'm like planning my grocery list in my head.
Right.
Okay, so we've got diet. What about stress? I know you're really big on the whole mind-body connection, so I'm going to guess that stress is not so great for our joints.
Yeah, you're right about that.
Okay.
When we're stressed, our bodies release cortisol,
Cortisol, right.
the stress hormone.
Right.
And over time, if those cortisol levels are really high, that can actually contribute to, you guessed it, inflammation.
Stress is literally inflammatory.
Yeah.
No wonder we feel achy and like run down when we're stressed out.
Exactly. And it becomes this vicious cycle.
Right.
Because when you're in pain, well, that can trigger stress and anxiety.
Yeah.
So it's super important to break that cycle.
Okay, so how do we do that? What are some effective ways to manage stress, especially if you are already dealing with like osteoarthritis pain on top of everything else?
Well, the good news is there's a lot of things that work, right? Mindfulness practices like meditation, deep breathing, those have been shown to reduce stress, and they can even improve pain perception.
I love those because those are things that you can literally do anywhere, anytime.
Exactly. And then don't underestimate the power of like gentle movement, things like yoga, tai chi, even just a relaxing walk in nature can do wonders for your body and your mind.
Those are all great strategies. Okay, so we've covered physical therapy. We've talked about what we eat. We've talked about stress management. What else can people do to optimize their knee health?
You know, another really important thing to mention is weight management.
Right, because extra weight puts more stress on your joints.
Exactly. So maintaining a healthy weight can be super, super beneficial, especially if you're prone to knee osteoarthritis.
Like supporting your body in every way you can.
Yeah.
It's so fascinating how all these pieces fit together.
It really is. Yeah. It's not about just one magic bullet.
Right.
It's about addressing all these different aspects
Right.
of your health and well-being.
I'm so glad that we got to like dive into this research paper.
Yeah, me too.
It's really been eye-opening.
It has. And you know me, I always like to leave people with a little something to ponder.
Of course you do. What's the thought-provoking question for our listeners today?
So we've been talking about knee osteoarthritis, right? But what if we thought about these principles, the movement, the nutrition, the stress management? What if we thought about those as preventative measures?
Oh, like that. It's never too early to start taking care of your joints.
Exactly. If we can start incorporating these strategies now, we can potentially prevent or at least delay osteoarthritis from developing later down the road.
What a powerful message to end on. It's funny, right? Like, we wait till something goes wrong and then we're like, oh, gotta fix it.
Right.
But what you're saying about prevention, it's like, we should treat our bodies more like our cars. You know,
I like where you're going.
like we take our cars to get like tune-ups, oil changes, you get your tires rotated, all that good stuff.
Right.
To prevent bigger problems. You don't wait till your engine seizes up to start taking care of your car.
Exactly.
Yeah.
Exactly. It's preventative maintenance.
Right. And maybe that's kind of how we need to shift our thinking about our health too. Like instead of just reacting to problems, what if we were more proactive about supporting our bodies?
Yeah. It's a really important shift in mindset.
Yeah.
And the good news is it doesn't have to be complicated, right? It's really those small daily choices, like how you're moving your body, what you're putting into your body, how you're managing stress.
It's like that saying, an ounce of prevention is worth a pound of cure, right?
100%, yeah. And you know, this paper does touch on a couple other points that I think fit in really well with this whole like preventative approach.
Okay. I'm all ears.
So one thing it really emphasizes is the importance of listening to your body.
Okay.
Paying attention to those early warning signs.
So not just like, oh, it's a little ache, it'll go away.
Exactly. Because a lot of times those little aches and pains, those are our body's way of telling us something's off, you know? And the sooner we can address those imbalances, the better.
Right. Like, it's like that check engine light in your car.
Yes.
You want to get that checked out sooner rather than later before it becomes a bigger problem.
100%, yeah. And then along those same lines, the paper also talks about the value of like regular checkups with a healthcare professional.
Even if you're not like experiencing any major problems.
Even then, yeah.
Yeah.
Because sometimes things can kind of sneak up on us without us realizing it.
Right. And like you said, early detection is key.
Absolutely. Think of it like a tune-up for your body.
Yeah, I like that.
Right. They can look at how you're moving, see if there are any areas of restriction or weakness, and then, they can give you some guidance on how to address those.
Right. And that way, hopefully, those things don't become bigger problems down the line.
Exactly. Exactly.
It's really about kind of taking that active role in your health
Yes.
rather than just feeling like you're at the mercy of your genes or your age or whatever.
100%, yeah. And that's what's so empowering about it, right?
It is. Well, this has been so insightful. I feel like we went way beyond just knee osteoarthritis. We've really explored like a whole philosophy
We did, yeah.
of proactive health and well-being.
Yeah, it was great diving into this with you.
Likewise. And a huge thank you to you, our amazing listener, for joining us on this journey of knowledge. Remember, taking care of your incredible body, it's an investment, not an expense. Until next time, be well.